We have with us today Mr. Reuben Best, a 67-year-old gentleman, and I really mean the word gentleman.
Thank you.
Because he is very much so. He's been a patient of mine for 21 years and has been on testosterone replacement for 4 years. And what was the problem that we started you on testosterone for?
I lost an interest in sex, number one, and number two, I was not getting an erection.
Well, it's hard to get an erection if you're not interested in sex.
But this is true.
If you're not stimulated.
Right.
So prior to the onset of the testosterone replacement, how often were you having sexual relations?
Prior to that, about twice a month, and just twice a month.
Well, was that a hot desire or sort of like a duty?
Sort of like a duty. You know, she's there. She's my wife.
You sort of felt compelled
yes,
to do it.
Compelled.
Okay.
Yes.
So we started you on testosterone replacement because your level was low, and then what? And also I should add that you didn't have any complaints about fatigue or tiredness or weakness, no depression, no anxiety.
Not
the
at
only
all.
thing was sexual.
Exactly.
So what happened after we started you on testosterone replacement?
But after you started me on testosterone replacement, the interest in the opposite sex recurred, and I found my wife attractive, so forth.
Well, how would you characterize how much did it return?
Well, it returned significantly in that if I saw her in the bathroom and I saw her legs, you know, although we were two elderly people, I felt I wanted to.
Okay.
But the thing again was the blood flow to the penis. So that's when you put me on Levitra.
Okay. So the libido came back, but you still couldn't get a full erection.
I couldn't get a full erection.
Okay. Which is the testosterone does not give an erection. It helps it along.
Okay.
And it's necessary for something like Levitra or Cialis or Viagra to work.
Yes.
So you went from twice a month, and how often did you start having relations after the testosterone?
Twice a week, and for me I could have it 3-4 times if my wife wanted to.
This started soon after you started testosterone?
The desire, yes, I would say about a week after.
Okay.
The desire came.
And now we're 4 years later.
Yes.
And the testosterone is still working the same way?
Still working the same way.
There's been no fall off?
No fall off.
Okay, so you're still sexually a 20-year-old guy?
That's right.
Okay.
That's right.
Well, very good. I'm glad it's still working, and maybe it'll work another 50 years.
Thank you very much. At 67 and 50 would be 117.
Yeah.
And
well, I promised you 120, didn't I?
Okay.
Yeah.
So I cut it short because Jesus might want me before then.
Okay.
Thank you very much.
Thank you very much.